Hello, my name is Joseph Fischer. This is going to be my CPE for my head-to-toe physical assessment for health assessment class with Dr. Torres. This is going to be my patient. It's going to be he, and his name will be Mr. Bear. All right. So I'm going to before I walk into the room, I'm going to knock. I'm going to announce and introduce myself. Hello, my name is Nurse Joseph. I'm going to be your nurse for this evening. And I'm going to begin to wash my hands before giving any patient care to the patient. I'm going to go ahead and identify with my patient. Mr. Bear, could you go ahead and tell me your name and date of birth real quick? Okay, it seems to match up with my orders. And then I'm going to ask if Mr. Bear has any allergies to medicine. Medication, food, or latex? No? All that checks out? Perfect. Okay. And then I'm going to go ahead and provide privacy and pull the curtain. And right after I pull the curtain, I'm going to wash my hands again just to maintain safety for the patient. Then I'm going to prepare the environment before any assessment occurs. I've already laid down this nice winter blanket for him, so we're all prepared. And I'm gonna ask if he's in any pain right now. Are you experiencing any pain? No? Okay. Perfect. I don't need to do the scale because he says he feels no pain, but just in case, I'll do the scale. If you want to rate your pain from a 0 to 10 scale, what would it be? 0? Perfect, Mr. Bear. I'm glad to hear it. And I'm gonna ask if he has any concerns about the procedure that's about to be happening. It's gonna be nothing crazy. I'm just gonna take a look at your whole entire body. There might be some slight exposures to your body. I will be checking your genitalia area, if that is okay. Yes, that's fine. Perfect. All right. And as I'm doing that, I'm gonna be setting the bed to working height. And I'm going to be assessing for his cognitive function, his appearance, his behavior, and his cognitive process. And it seems to check out well. He's responding well to me. He's talking well to me. He just let me know that it is okay for this procedure to happen. And I'm going to go ahead and assess for orientation to see if he's oriented. So I'm going to ask if he knows where he's at, what's today's date, if he knows today's president, and he knows who he is. And yes, he is oriented to person, place, time, and he knows today's president, so he's oriented to an event. I forgot, an event, if he knows what he is doing at this place currently. And yes, he checks out for everything, and I'm certain to say he is alert times 4. All right, so I think, yep, I think I'm safe to move on to head and neck. So I'm gonna go ahead and start to assess for his head and his neck, as said. Before anything's done, I have to position the bed upright to 45 degrees, just so this assessment can go well. And now I'm going to begin to palpate his head to see if there's any bumps, lacerations, or lumps, and the skull for his size and shape, and the hair texture. To see if it's well groomed and well kept, which it is. Mr. Bear knows how to take care of his hair. And then I'm gonna move on to the ears. I'm gonna inspect and palpate for the external ear size, shape, condition. I'm gonna see if there's any pain, edema, redness. I'm also gonna check inside the ears through here. Yeah, I'll use this. I'm gonna check inside the ears to see if there's any swelling, excessive wax or cerumen, no redness or no drainage. I'm sorry, no drainage. I said drain. And the skin seems all good. No redness. I said that like 3 times. I'm sorry. But, and then I'm going to go ahead and assess his facial structures to see if there's any tenderness around his sinuses. I'm going to move it over to the nose and check his sinuses and his mastoid and his frontal. I'm going to check inside his nostrils to see if there's any damage to the septum. And no, Mr. Bear does not have a deviated septum. He seems all good and in check right there. Good, Mr. Bear. And then I'm gonna go ahead and move on to his eyes. No, first before that, I'm gonna do his eyebrows. I'm gonna see if they're even and all to check. And yes, has very nice eyebrows. And now I'm gonna move to his eyes, I believe. So I'm gonna check on his eyelashes as well, along with his conjunctiva and his sclera. And while I'm doing that, I'm gonna also check his cornea, his iris, and his visual reflexes. So to do that, I'm gonna go ahead and dim the lights and assess his pupils for accommodation and reaction to light. And I'm gonna turn the lights back on. And that seemed to be checked out perfectly. His pupils accommodated to dim lights perfectly, all in normal. And now I'm gonna grab a pen. And I'm gonna have him follow the light. This isn't a flashlight. This is a Sharpie, but we'll pretend this is a light. And I'm gonna move the pen up, down, side to side, and far away, moving closer to see his eyes react to it and follow it. And his eyes are perfect. In medical terms, they are perla. Pupils are equally round and react to light, and accommodation is perfect. Okay. So now I think we're good with the eyes. We're gonna go ahead and inspect and palpate the neck. So, we're gonna go ahead and palpate the cervical head nodes in order. So we're gonna start with the preocular lymph nodes. So we're gonna go preocular, I believe, and then posterior ocular behind the ear, and then occipital a little towards the below the posterior ocular, and then I believe it's up to the mastoid, and then the occipital, the submental, the submandibular, and the tonsillar. Then we're going to move down to palpating the superficial cervical and the deep cervical, and then the posterior cervical. There's 3 cervicals that I palpated for there, and then the and then what was it called? The supraclavicular, right there. That's the last one I'm palpating, and I state I do not feel any swollen lymph nodes. It went all perfect in the check. Next, I'm gonna go ahead and inspect the mouth and the throat for lacerations, any problems with the teeth. The lips are normal, and Mr. Bear, he's a young Mr. Bear, so he does not have any dentures, but if he did, I would also check for that. And I'm gonna assess for any jugular venous distension. Wow, I'm gonna tilt the head of the bed back to 30 degrees and see if there is. And yeah, it all checks out perfectly. I'm gonna assess for the carotid pulse, but not at the same time. because it will put on risk patient to passing out, and we don't want that for Mr. Bear. I'm gonna assess it for its force, its rate, its rhythm, and its symmetry. So I'm gonna do the right one first. I'm gonna do the left one next, and it's +2 and regular. It's going well for Mr. Bear. You're in top shape, Mr. Bear. I'm very proud of you. So, I think we're gonna move on to your chest and back now. I think I'm gonna move on to your chest and back. Oh no! Before that, I'm gonna go ahead and ask you if you are frequent, if you do testicular examinations on yourself, testicular examinations on yourself. Do you commonly check on yourself? You routinely check on yourself? You do, Mr. Bear? Perfect. And you don't notice anything wrong? Nothing wrong? Perfect. I'm so glad to hear it. Alright. And now I'm going to move on to the chest and back. So I'm going to go ahead and place my hands on Mr. Bear's shoulders, and I have him shrug and check and see if he can do that. He can do that perfectly. I'm going to check his cheek resistance and for equal response and strength. And then I'm going to go ahead and check his trachea and suprasternal notch. I think that's what it's called. I'm going to go, well, since he's facing this way, since his bed, usually it's better to check for the trachea from behind. But in this case, I'm going to go ahead and check it from the front. I'm going to push it to the side, see if it's good and it checks out well. And then I believe from this point forward, Mr. Bear, I'm gonna have to partially remove your gown to go ahead and osculate your lung sound. You're gonna see if you're breathing properly here. And then for this part of the CPE, I'm gonna be using these headphones as my stethoscopes. So I'm gonna go ahead and put these on my ears. And we are gonna go ahead and lift your gown and osculate for your beautiful lung sounds that we need to hear. Alright, so I'm gonna go ahead and instruct Mr. Bear to breathe deeply through the mouth during osculation. And I'm gonna go ahead and osculate all lobes. So we're gonna go ahead and start up on the top with tracheal, both of them. 2 up there on the tracheal. Perfect. And then we're going to go down a little bit and osculate the bronchial. The 2 right there. Perfect. And we're going to osculate for bronchovascular. 4 right there. And then the breath, and then the vascular breath sounds. Perfect. Okay. Yeah, since you don't have a tiny chest, it kind of felt like it was all in the same place, but I was moving down. I was moving from top to bottom, osculating those breath sounds. Or after doing side to side, I was doing the side to side motion, from left to right, and then from right to left, moving my way down all the way to vascular. Okay, and then I think I'm gonna proceed to osculate your aortic, and your pulmonic, your aortic, your pulmonic, herbs, and tricuspid, in the mitral area for the pitch, the loudness, and quality. I'm gonna use those landmarks, so I'm gonna go ahead and osculate that. Here goes the aortic, pulmonic, herbs. Right there next to it, kind of below it, and then the tricuspid, and then the mitral area. Perfect. All right. It doesn't seem there are any gallops or any murmurs inside the aortic area. Also, in all areas, there were no gallops and murmurs as I listened to it. Okay, so I think, and then I'm gonna go ahead and palpate his apical pulse, which is around the left center, just below his nipple. So I'm gonna go ahead and palpate for it. Pretty easy to find. A well strong pulse. So this is perfect, Mr. Bear. So I went ahead and palpated that. And then I'm gonna since I still have my stethoscopes, I'm gonna oscillate for his apical heart rate, and I'm gonna listen for a full minute. Yeah, a full minute for his apical heart rate. I'm gonna oscillate that. All right, perfect. Okay, so after that, I'm gonna continue with his chest assessment, which is inspecting and we're just inspecting of his chest, and then I'm gonna also just palpate to see if there's any pain around his chest area or any abnormalities really. And then next, I'm just gonna have my patient go ahead and sit up. And then I'm sorry. And then I'm sorry, I'm having a brain fart. I'm sorry, Mr. Bear, hold on. I went ahead and did the apical pulse. And I did the full minute. And then now I'm going to assess the respiratory rate and the patterns and the quality of respirations on the back. So since you're going to be sitting up, I'm going to be able to reach your back. I'm going to go ahead and inspect the back just as I did at the front of the chest. And I'm going to have the patient take a deep breath while I'm placing my hands like this. So if you can see that, it's kind of hard because he's a tiny bear, but with the thumbs right there kind of supporting it. And I'm going to place, I'm going to have him take a deep breath, placing my hands, and assess for the diaphragm expansion and equal rise and fall of the lungs. Yeah, the equal rise and fall of the lungs. Okay, perfect. I needed a deep breath in myself. Okay, so now I still got my stethoscope on deck, in hand. And now we're going to go ahead and oscillate the lung sounds posteriorly. So first, before the stethoscope actually, I'm going to feel it with the palm of my hand and have him repeat 99. Okay, and then I'm going to go ahead and have him keep repeating that with the stethoscope this time. Perfect. Okay, and now I'm going to have to ask you, Mr. Bear, to whisper 1, 2, 3. And I'm going to go ahead and listen to it with the stethoscope. Okay, and then can you repeat the sound E for me? Can you do that for me? Perfect, Mr. Bear. I'm going to listen to it with the stethoscope. And it is normal because I cannot hear it clearly. It sounds distorted. Now, I don't know why I'm turning around. Now I'm going to inspect... I'm gonna expect his rib cage. I'm sorry, his chest, his thoracic cage for symmetry, size, any abnormalities. And it seems to check out his AP diameter and yeah, he has a normal diameter. And Mr. Bear, I think, hold on, give me a second. I think you're good. You're all checked out to have you lay back down. You're fine. You did perfect. So he was facing this way the whole time. I'm sorry. I had to turn him around to oscillate, but he was facing this way. Have him lay back down on the head of bed that is 45 degrees still. Okay, and now I'm gonna assess your arms a little bit. Your arm reactions. Is that okay? Your arm reflexes, perfect. So I'm gonna assess their reflexes. Yep. Okay, that checks out. And then I'm gonna go ahead and I'm gonna go ahead and assess for the pulse of his brachial, his radial, and his ulnar pulse, and all of them seem to be +2 in regular. I'm gonna go ahead and assess the range of motions of his arms, and his see if he could the range of motions for his shoulders. I can't really do it because his arms are tied. I don't know why. But I'm assessing for his range of movements for his shoulders, his elbows, his wrists, and his hands. And I'm going to palpate his joints for any tenderness or slowness. And if there's any resistance to pressure and abnormalities. And it all seems to be in check. And while we're at the arms, I'm going to inspect the skin and hair distribution and texture. Hold on. Okay. I'm gonna inspect the skin and hair distribution and texture. And I'm gonna assess for the I'm gonna assess for his palms. No, before that, I'm gonna see if there's any skin turtle. And then I'm gonna go ahead and inspect his palms and nails and to check for clubbing to see if there's any clubbing with his nails. And then as well as assess for capillary refill, which I'm going to press on her nails and see if it refills less than 2 seconds. So let's do that to you. Perfect, Mr. Bear. I'm so glad you're being so cooperative with me today. And I'm going to have him close his eyes. And I'm going to touch one of his fingers, and I'm going to ask him to identify which finger that I'm touching his index finger, his right index finger, and yes, that's the one he states that we have. Let me go ahead and put my stethoscope away from that. And then can you go ahead and squeeze your fingers bilaterally? Perfect. Okay. Now, we're gonna assess for your axillary nerves. We're gonna start with your lateral axillary, and then your superficial axillary. Next is gonna be your subscapular, which is gonna be a little posterior, and then we're gonna move towards your pectoral, towards your chest just a little bit, and that's gonna be your anterior. And with the and I don't feel any swelling of these auxiliary nodes, so that's perfect. And then and the trochlear, the epitrochlear nodes. Okay. All right, Mr. Bear. I think we're gonna move on to inspecting your abdomen. We're going to inspecting your tummy today, see if there's any abnormalities or bowel sounds that we could find. But I'm sure it will be all in check for you. You've been doing so well so far. So would you go ahead and lay back down for me? So Mr. Bear's gonna lay down, supine on his back, and then I'm gonna just look and inspect for any lesions, any size differences or abnormalities, and pulsations, and any abnormalities in general. And it seems to be good so far. It checks out well. I'm not feeling any lumps or any abnormalities. I'm gonna go back to my stethoscope. Gotta put this back on. I just put it away. I'm sorry. I'm gonna osculate your stomach. It might be a little cold. My stethoscope's cold. I know I should have said that before putting that on your back. I saw your reaction to the cold. I'm sorry, but the stethoscope's still cold while I'm gonna be osculating or listening to your tummy. All right. I'm gonna spend 1 minute per quadrant. I'm gonna start in the lower right inguinal. I think that's how you say it. I don't know how to say it. I'm gonna start in the right quadrant, the lower right quadrant, and then I'm gonna move to the hypogastric and the pubic area. Listen for a full minute, and then the left inguinal. I'm gonna move up to the left lumbar, and the umbilical right near the belly button, and the right lumbar, all for 1 minute, and then I'm gonna move up to the right hypochondriac, the epigastric, right below his hypogastric, right below his sternum, just a bit, and then his right hypochondriac. That's all 9 of the regions, 3 on each row, if I remember correctly. I listened for 1 minute, and I hear normal and active bowel signs in all the quadrants. You check out for everything. Mr. Bear, I'm so proud of you. Do you mind me asking about your last bowel movement? If there are any abnormalities that you're not used to, if there's any blood, and if there were, can you just tell me the color? If there's any foul odor that abnormal odor that you're not used to, the consistency of it, how many times are you going through your bowel movements a day, and the amount, if it's an abnormal amount, or if it's not the amount you're used to. No, you've been pooping great. That's great, man. I'm glad to hear it. What about your urination? If there's any abnormal smell or problems with the flow, are you incontinent sometimes? Do you pee at night at all? Is there difficulty stopping the flow? Any pain? Your urgency is normal, like none of that. Dribbling. There's another one. Dribbling. I probably already said it, but any difficulty? No, Mr. Bear. Everything checks out on your urination patterns. You pee a-okay. Awesome. Okay. For next, I'm gonna go ahead and inspect your lower region, Mr. Bear. As you said earlier in the beginning, as I said earlier in the beginning of this inspection, I would be checking your lower private areas. I just want to go ahead and verify that you are okay with this and that it's fine with you. I promise it will be quick, neat, and you have nothing to worry about. Yeah, that's okay? Alright, Mr. Bear. So I'm gonna go ahead, before I do any of this inspection of the private area, I'm gonna go ahead and wash my hands. I'm gonna put on a new pair of clean gloves. I'm gonna go ahead and assess his femoral pulse right there in his like inner thigh area for its force and rhythm, and it seems to be +2 and regular. I'm gonna go ahead and do it on the left femoral pulse as well. I already did on the right, on the left, just to make sure it's consistent with each other and both of them are +2 and regular. I'm gonna go ahead and palpate your bladder just right there below to see if there's any tenderness in there. No, there's no pain there. Perfect. And now I'm gonna go ahead and lift the gown and check your inguinal area. I'm gonna go ahead and inspect and palpate the inguinal nodes. All right. Perfect. We're all good. Okay, so I'm gonna go ahead and put his gown down for privacy. I'm gonna remove my gloves. I'm gonna wash my hands, and then at this point, I'm gonna have you, or we already had you at this case. We already had you pee in a cup for us, and we inspect the color of it, the odor, and the amount, and it came out to be normal. So looks like you're on check for your urination, and I saw no issues with your private parts down there. So you're all on check, Mr. Bear, on that. We're gonna go ahead and move on to checking your posterior. Okay, so we're gonna go ahead and move you on to your side. All right, and we're gonna, and I'm gonna go ahead and inspect your I'm sorry. I inspected your. I removed my gloves. I washed my hands. Removed my gloves. Okay, so I'm gonna go ahead and inspect the skin of the back. Hold on, let me go ahead and see if my phone's still recording. My phone is still recording. It likes to turn off sometimes. Okay. Posterior inspection. I'm gonna put you on the side. I'm gonna go ahead and inspect your back, and there is no edema present at all in the sacrum. I'm gonna inspect the sacrum as well, and there's no edema in the sacrum, and no edema present in this inspection. And then I'm gonna go ahead and inspect your anus, Mr. Bear, if that's okay. Yes? Alright. I go ahead and inspect the anus and see that there are no lesions, no discharge, no damage, and no hemorrhoids. So that checks in perfectly. So you could go ahead and return back to laying down on your back in supine position. So now that you're on your back, I think it's a good time to check your legs and see. We already checked your arms, we checked your chest, we checked your respiratory and your back, your anus, your private part, your head and neck. Now we're gonna check your legs. And yeah, we're gonna check your legs. We're down to your legs, so this is good. We're getting down there. We're almost done, Mr. Bear. I'm so proud of your patience. Okay, and now we're gonna inspect the legs. See skin, texture, size, color, and then I'm gonna assess for any any scars, lesions, abrasions, any bruising, ulcers, tenderness, if any, on any point of the legs. We're just gonna go ahead and inspect that. Now we're gonna go to your feet and heels. I'm gonna go ahead and check the condition of your nails on your feet, and then while I'm checking the nails, I'm gonna assess the capillary refill on both of your toes, on both of your feet. I'm sorry, and they both seem to refill. Excuse me. They both to refill less than 2 seconds. And then same thing with your fingers, Mr. Barry. I'm gonna have you close your eyes. I'm gonna touch one of your toes. And can you identify which toe it is? Perfect. All right. He identified perfectly of which toe I was touching while his eyes were closed. He's in check there. His capillary refill is less than 2 seconds in his toes. There's no abnormalities inside his legs, no lesions, no bruises. Mr. Barry is all clean to go from there. I'm gonna go ahead and assess. I'm gonna go ahead and assess your quadricep and Achilles reflexes. So I'm gonna have you push. I'm gonna go ahead and push against the feet just to see the reflexes. Perfect. I see it inside the quadriceps and the Achilles. Perfect reflexes once I push against his feet. like so. You don't really have too much quadriceps to work with, but we'll work with it. Next, I'm gonna assess for the range of motion. The range of motion for your knees, your ankle, and your foot, and even your hip. Your hip range of motion seems to be checking out for your left lower extremity and your right lower extremity. I don't know if I already checked the pulse. No, I did not check the pulse on your feet. So I'm gonna go ahead and check the back feet pulse. I'm sorry. I'm gonna go ahead and check the pulse on your feet. I believe it's called the dorsalis pedis pulse. I'm gonna go ahead and assess for that pulse. And then yeah, that's all the pulses I can remember right now. But it seems to be +2 and regular. I know there's more pulses I need to assess here, but forgive me, I can't remember it so far. I remember the foot one. The tibial, I'm gonna go ahead and assess the tibial pulse as well. And then the pop. Okay, for right now, those are the pulses I assess. They're +2 and regular. I assess the range of motions, and there's no tenderness, lesions, ulcers, bruisings. Texture seems fine. There's even hair distribution in the lower extremities, right and left, even. Reflexes are great when I push against the feet. Pulses are great. I think that should be in check for your lower extremities, Mr. Bear. I appreciate your patience. Everything is normal going on with your legs. So, last but not least, I'm gonna go ahead and have you sit up and stand as I'm gonna assess you sitting up and standing up. But before I do that, I'm just gonna make sure your bed is locked. I verify it, and I would ask for you to please put on or I'm gonna go ahead and put on some socks for you because you're about to be standing. So I put some invisible socks on Mr. Bear's feet. And then I'm gonna lower the bed. As it's locked, I'm gonna lower the bed to the lowest position. And then I'm gonna go ahead and check your pulse. At this point, I'm gonna check your pulse. And now I'm gonna have you sit up. Are you dizzy in any way, Mr. Bear? No? Okay. And as I'm asking that, I'm gonna check his pulse again. Okay, perfect. They seem evenly. They're consistent with each other. They're the same. And then I'm gonna help the patient stand. And as he stands, I'm gonna ask if there's any dizziness, and I'm gonna check the pulse again. Perfect. Okay, all of them seem to be consistent with each other and even. So Mr. Bear is now standing for me, and now I'm gonna assess his movement and his coordination. I'm gonna have him face this way, and I have to ask him take 5 steps back away. Perfect. The coordination is good on him. It seems very evenly distributed. There's no gait. His balance, his posture is correct, and he has no struggle to stand whatsoever. So this is really good. Now I'm gonna go ahead and have you Oh, I need to check your back real quick. Just go ahead and see if your spine is in alignment. And yeah, you have a very aligned spine right down middle, along with your great posture. So that all checks out. I need to check for your diaphragm and see if it expands correctly in your costal angle, I believe. I'm going to check that posterior, and then I'm going to go ahead and check in front too, to see if your diaphragm is expanding evenly and unlabored, and it is. So, and we already checked that out a little bit in respiratory for the, I believe the front side, I forget, but we went ahead and double checked it again. I'm sorry for the repetitiveness. And then I think next I'm gonna go ahead and palpate your joints for any tenderness. There's no tenderness, no swelling, no abnormalities. There's no crepitus, and there's no resistance to pressure. So I think you're on track to sit back down and then you could go ahead and lay back down to me. I'm gonna go ahead and fix your bed for you, right back up for you, sir. We're just about done here. I think. Hold on. Okay, sorry. Gait. I assessed for his balancing gait when he stood up. Yes. His spine alignment, I assessed for. I've had him turn around after taking 5 steps back. I assessed for his alignment. And And then I did his diaphragm expansion, his costal ankle. Yeah. Okay, so Mr. Bear, I think we're all done here. I would like to ask you if there's any concerns of what you have over this inspection and assessment process at all. No concerns whatsoever? Okay, perfect. Okay. So I'm gonna go ahead and have him lay back down. I'm gonna put the handrails up. I'm gonna put the call light within the reach of him. I'm gonna open the curtain, and I'm gonna as I'm washing my hands, I'm gonna ask if there's anything else you need, Mr. Bear. The call light is within reach, so please do not be hesitant to let me know if there's any concerns whatsoever, or anything you just want to ask or talk about. Please feel free to let me know. And I'm done washing my hands after I open the curtain. I open the curtain and then I wash my hands. I made sure to know that I am available to reach, and then I'm gonna go ahead and leave the room. And this concludes my CPE on the physical health assessment. Thank you.